Hello everyone, this is Dr. Dimov, the chairman of the Youth Scientific Association Asclepius at the Medical University of Plovdiv, with the second presentation dedicated on the low-hanging fruits of student research. And in this time, we will be discussing writing a case report. As the previous time, I will try in this presentation to answer the questions: what is a case report, why we would like to write it, and of course, how is it done? In the beginning, a definition: a case report is a short and focused description of a single patient case that is in some way unique, rare, or unusual. What is suitable for a case report? Well, for starters, the occurrence of a new disease, which, well, doesn't happen every day, although quite recently it did happen and it went pandemic. Much more common would be, of course, the occurrence of a new symptom or a combination of symptoms that haven't been described in that way so far. Another thing that is suitable for case report is the use of a diagnostic tool or a procedure in a novel way. This usually affects the field of image diagnostics or pathology. So when we are using a regular known technique with a different, let's say, modality or in a different way, so that it provides different information. And quite commonly, case reports are dedicated to specific unreported so far drug reactions or drug interactions causing adverse effects, and of course reactions to specific treatment procedures that are rare or unusual or strange, you could say. Why do a case report study? Well, there are two key points about every case report, and those are originality and clinical implication. First of all, as the famous aphorism goes, diseases don't read books. So we cannot expect that every time when we handle a certain disease, it will, let's say, behave in the same way that is described in our textbooks. In other words, it is beneficial for us to be aware about the possible exemptions as well. That's why the add-on to this aphorism is that doctors should read books all the time. Another beneficial thing about case reports is that it gives experience in case presenting. And this is especially important for students or for newly graduated doctors, because whoever chooses the clinician's path, presentation of patient cases will be something that you will have to do on a regular daily basis. And the better you are at it, the better you will be able to do your job. And also, you will have less chances of pissing off your superiors, which in general will make your life easier. Sorry. And as compared to the long and complicated clinical studies, which involve a large number of patients and placebo control and different cohorts and follow-up, the case report seems like a much easier task to do. And in the end of the day, if we prepare a good case report, then it should be able to improve individualized patient care, or in other words, to help us not miss the zebras. This is a metaphor taken from this book, How Doctors Think. It's written by Jerry Groupman, who is a doctor. And in this book, I do recommend that book, by the way. In this book, he speaks about this phenomenon that when we hear hoofs pounding, we usually think about horses, right? It might be zebras, but the probability of that is lower. And this is the way textbooks are written. This is the way we as doctors are being trained by the system. And well, in the end of the day, this is the way evidence-based medicine works. You know, statistics reigns it all. So by always thinking about the most common reasons for this and that, we might pretty well skip some important cases that are, well, not following the normal routine, right? So, how to write a case report? Well, I would recommend first you get in contact with a clinician who would be your mentor. It might be your assistant professor in a certain discipline, or a doctor that you know because you go and volunteer in a certain department that is of interest to you. This doctor is of crucial importance, guiding you through the process, not only because he or she could provide you with all the needed information, but because they could also uh, advise you whether the case that you pick is actually interesting, or is it suitable for writing a case report. Because quite commonly, for the inexperienced person, a lot of cases might seem very interesting, but then again might turn out that they are absolutely trivial. So, best case scenario, this doctor is also personally responsible for treating the patient that you pick to write a case report about, but it's not necessary. Uh, of course, it's not obligatory. So once you do that and pick an interesting topic, interesting patient with a unique or rare condition, you go back a step and study the disease or this condition in general, so that you're able to answer the question, why is this one different? Then, of course, you have to dig deep in patient's history, try to get a hold on as much information as you could, about previous visits to the hospital or ambulatory care, all the different consultations that this patient has had, or different tests, paraclinical, image diagnostics, you name it. And then, of course, you have to select the important. The emphasis here is on important, not only interesting data. I have put here this asterisk because it should remind you that what is interesting for you might not be interesting in general. So again, consult your mentor. Of course, I guess needless to explain is that while picking this information, you have to make sure that when presenting it, the identity of the person will not be revealed. And this has been like that in medicine since long before the GDPR thing. And of course, in the end, prepare a discussion. So how would you explain the, let's say, white and black stripes of your zebra among the variety of horses around, if I may use the same metaphor? While preparing your case report, don't forget to consult your mentor regularly. There might be moments when you feel drowned in a lot of information, or you cannot properly pick what is important and what isn't. So this experienced doctor will help you in that process. Also, they might help you in the very beginning, providing sources of information for you to prepare about the disease or the condition or the drug in general. Another very important thing is that it will always be advisable to consult other specialists involved in the diagnostics and treatment of this specific patient. This might include the pathologist, the pharmacologist, image diagnostics specialist, or anyone who might give you a different point of view, because it might turn out that your rare or unique case is not actually unique from every single point of view. It might be, let's say, unique from rentgenology point of view, but be absolutely trivial from laboratory point of view. So it is always good to get the full picture, consult other specialists involved, and get their points of view. And in the end, you should be, of course, able to answer the questions: why is this case interesting? What can we learn from it? And what's the benefit of all that? What good does it bring? So how can we improve? So the take-home messages of this talk would be: first, the case report should present something unique. This might turn out to be very hard to find, actually, or at least unexpected. It will require in-depth knowledge of the problem, so it is actually not so easy as a task as it may seem in the beginning. You should try your best to gather as much information as possible. The thing that I spoke to you about in the previous slide, so different points of view. And well, as opposed to, let's say, a review paper, which I believe you could pretty well do on your own, writing a case report on your own would be almost an impossible task, even for students in the later years, let's say even for 6 years students who are not only involved the in the maintaining the documentation of different patients, but also uh, taking more active part in the diagnosis and treatment. I believe even for them it would be near to impossible to prepare a case report without the guidance of an experienced clinician. And then, of course, you shouldn't forget in the end to discuss the novel point of view that your case highlights, and probably to give some recommendation what to check in the future for people who have to deal with similar cases. So that's all from me. Thank you all and good luck with writing your case reports. I remind you that there are still 2 weeks remaining for abstract submission for the Science in Youth Conference 2021. So I hope the students are done with the exam session already, and good luck to anyone who would like to participate in this conference.